Let's move on to another issue where I think the mainstream media have been exercising what I think they call in basketball a full court press, where you simply keep saying something louder and louder and louder and finding people that support it or to pass your ball to, and you try and create a new reality. And the new reality being that the coalition government is utterly incompetent, and Lester Levy, the man they have brought in to sort out the health system, is incompetent and will waste money, and the whole sector is in even greater crisis because of the terrible government's policies than it ever was before. And we see stories in the papers all the time, waiting queues, GPs leaving, health and crisis. The word crisis is just everywhere when it comes to health. Well, I thought I do not know enough about the health system. I don't know enough about most things, really, to really say, is this narrative that I suspect, because it's coming from the legacy media, is false? Is it true or not? So I thought we'd go to our good friend, and I think just the country's leading health systems and policy expert, Professor Des Gorman, to kind of get a progress report on where we're at with the government's attempts to fix the problems in the health system. Des joins us on the phone now. Des, lovely to talk to you again. How are you?
I'm good, thanks, Sean. How are you?
Very well, thank you. Apart from the sleep I'm losing over the increasing crisis that evil Lester Levy has caused in our health system, would you agree that the narratives through mainstream media are very negative?
Yes, and they have been for a long time. I think, Sean, although there's been the odd person like Sir Ashley Bloomfield pop up and say there is no crisis, there is, and I think most of us would concede that the health system's been in crisis for a long time. We have Labor Party people jumping up and saying this is purely a matter of more money, and the situation we're in now is because this government has not invested adequately in health. That's nonsense. I mean, if more money was going to solve this problem, Sean, it would have solved it a long time ago. Our fundamental problem is that our hospitals have a universal health care basis, and that's been there since 1938 with Michael Joseph Savage. And the problem with universal health care that we have is that it's very clear who's entitled, all New Zealanders and all New Zealand permanent residents. But it's not clear what we're entitled to. It's never been defined. It's never been described. And so if you think about it, we have a uncapped, undefined demand and a finite resource. So, of course, there's going to be problems. And, of course, we're going to have funding issues. And just more money, with all due respect, doesn't solve that fundamental problem. We're currently spending about 10% of GDP on health. So what's enough, 11, 12, 13? So, look, frankly, if what the media is calling for and what the voices of the media are calling for, which is more money for health, will solve the problem, with all due respect, it won't. If it was going to, it would have. I know the GPs are saying, look, we've got some financial difficulties and we need some catch-up funding. But frankly, that funding, if it comes, will simply help them address their bottom line. It won't produce one extra service or one new service. So from the public's point of view, why would the government spend money on a group of people who are already struggling to provide the services that we need? So are we in crisis? Absolutely. Is the media describing it rationally or reasonably? No, not at all. Is the argument that this is purely a matter of more money naive? Yes, very much so. What we've come to is a point where we've got a system which has outlived itself. It's outlived its utility. And it's time for a new broom.
Yeah. Des, look, that's one of the best answers to any question I've ever asked in my career, because I think you make this great point, and I think now back to the media coverage I've been reading for the last month, and it's all about catching ministers out on figures and dollar figures and saying, I got you, and how can you do that for this money, which is stuck in a thinking that this is purely a financial issue rather than a wider, if you like, managerial, philosophical, structural issue.
Oh, and look, that's absolutely right. I think the obsession with more money will fix this comes from the last 80-odd years of trying to make Michael Joseph Savage's vision work. But the fundamental problem is, if you're going to have a universal healthcare system, you not only need to define who's entitled, you need to define what they're entitled to.
Yeah.
You need to actually describe what services they're entitled to. And in those countries which run social insurance schemes, like, for example, Switzerland, they define exactly what people are entitled to.
Yeah.
So that you can know exactly what you can expect for the insurance that you pay, which the government refunds. But the problem is that we have a system which is unworkable, and we've been trying to make it work for the last 80 years. And we've had successive, particularly Labor governments, trying to socialise primary care, because in 1938, when Savage introduced the universal healthcare scheme to hospitals, the GPs, who were the New Zealand chapter of the British Medical Association, opposed him and defeated him, and retained the right to charge a fee for service. 2 points to make about it. One is, can you imagine a man with all the political capital of the Great Depression being rolled by the GPs? It shows just how powerful political economies are in health. And the other is we ended up with a system which is free care within hospitals, but fee for service within the community. So the system doesn't even have...
Oh, that's a good point. We pay to go to the GP, but we don't pay to go to hospital.